All right, let's jump into another deep dive. You guys know I'm all about those interesting medical mysteries, and today we're tackling one that's pretty close to home for a lot of folks.
You bet, reproductive health. Always a fascinating area, even if it can get a bit complex sometimes.
Totally. We got this PDF from one of our listeners, jam-packed with info about reproductive pathologies. And like, wow, there's a lot to unpack there. So we're going to break it down, hit the highlights, stuff that's interesting and useful.
Yeah, even for folks who aren't doctors or nurses, this stuff is relevant to pretty much everyone.
Absolutely. Impacts us all in one way or another. So before we get into the nitty-gritty of specific conditions, I think we got to do a quick recap, right?
Basics, always good.
Exactly. The PDF throws around terms like menarche and menopause, which are like textbook words. Any way to explain those simply?
Sure. Think of menarche as like the welcome party for your period. It's when menstruation first starts.
Okay, I like that.
And then menopause, that's more like the farewell tour. It's the natural ending of those cycles.
Makes it way easier to remember. Speaking of periods, the PDF also mentions those menstrual irregularities,
Mhm.
when things aren't quite textbook. What are some of those?
Well, you've got amenorrhea, which basically means no periods.
Okay.
It can be primary, meaning they haven't started by a certain age, or secondary, meaning they stop after a woman's been having them regularly.
So like pregnancy would be the most obvious reason for that secondary type?
Exactly, most common reason. But could also be things like extreme weight loss, too much exercise, or hormones getting out of whack,
Wow, so many things can throw our bodies off. It's crazy how sensitive they are.
for sure. Then you've got dysmenorrhea, fancy way of saying painful periods.
Right, some cramping is normal, but I've heard some women have it really bad.
Absolutely, varies a lot from person to person.
Makes you realize there's no one-size-fits-all experience.
Nope, everyone's different.
One thing that really stuck out in this PDF, this case of Lena Marcela Medina de Garado, youngest mother in history, gave birth at 5 years old. Like, what?
Yeah, that one's wild. Shows you just how complex this whole system is. And there's still a ton we don't know.
Makes you think, for sure. Speaking of complex, this PDF spends a lot of time on benign breast conditions. What are the big things people need to know?
Well, firstly, these are way more common than most folks realize. And while benign means they're not cancer, doesn't mean they can't be annoying or scary.
Right, makes sense. I know there are different types of those benign breast changes. The PDF talks about proliferative and non-proliferative, which always confuses me.
Yeah, those words, okay. Think of proliferative changes as those where cells are growing more, which can make the risk of breast cancer a bit higher later on. But non-proliferative, those don't involve that extra cell growth, so no added cancer risk.
Ah, okay, that's much clearer. So fibrocystic changes, which the PDF says are super common, would fall under the non-proliferative type.
You got it. With those, breasts feel lumpy, tender, can make self-exams tricky because it's harder to tell normal lumps from anything unusual.
Makes sense. Knowing your own body, what's normal for you, is key. The PDF also mentions galactorrhea, which is like milky discharge from the breasts when you're not pregnant or breastfeeding. What causes that?
Could be a few things. Sometimes it's hormones being off, certain meds, or even just stimulating the breasts. But sometimes it's a sign of a prolactinoma.
Ah, those. They're the benign tumors in the pituitary gland, right? Crazy how those can cause tunnel vision because of where they are in the brain.
It is wild how seemingly unrelated symptoms can be tied to one specific thing.
For sure. Definitely makes you want to pay attention to any changes and talk to a doctor if something's weird.
Always better safe than sorry.
Now, speaking of things that can be serious, breast cancer. The PDF talks about risk factors. What stood out to you?
Well, it's key to remember some risk factors are within our control, like keeping a healthy weight, not smoking, not drinking too much, but others like genetics, family history, those we can't change.
Right. And the PDF mentions those BRCA gene mutations. If you inherit those, the risk of both breast and ovarian cancer goes way up.
Yep. BRCA1 or BRCA2 mutations can increase breast cancer risk by as much as 80%. And it's not just breast cancer, it ups the risk for ovarian cancer too, which we'll get to later.
80%. That's huge GE. Really shows you the power of genes.
Absolutely.
So if someone's got a family history of those cancers, talking to a doctor about genetic testing might be a good idea, right?
Definitely worth discussing. Early detection, knowing your risk, that's huge with any cancer.
Absolutely. Okay, let's shift gears now. Ovarian pathologies. The PDF mentions benign ovarian cysts. I know those are pretty common, but what causes them? Are they usually something to worry about?
Well, they actually form pretty often as part of a woman's regular cycle. Each month, a follicle, which is like a fluid-filled sac with an egg in it, grows on the ovary. Sometimes those don't release the egg or they don't fully dissolve after ovulation. That's when you get a cyst.
So they're like little bubbles that come and go.
Kinda, yeah. And most times they're harmless, go away on their own, but can grow big enough to cause pain, pressure, or even burst, which needs a doctor to sort out.
Ouch, that doesn't sound fun. Now, unlike those often harmless cysts, the PDF talked about ovarian cancer, which has a much scarier reputation. Why is it so dangerous?
It's often called the silent killer because those early symptoms are so vague, easy to miss. Lots of women just feel bloated, a bit uncomfortable in their belly, maybe some changes in their bathroom habits. But those could be signs of a lot of things.
So it's tough to catch it early on.
Sadly, yeah. By the time more obvious symptoms show up, it's often spread, making treatment harder. That's why knowing about it, being aware, is so important.
Definitely makes you realize how important it is to pay attention to your body, even small changes, and talk to your doctor if anything seems off.
Absolutely. Can't stress that enough.
Okay, the PDF also talks about polycystic ovary syndrome, or PCOS, which seems to be getting a lot of attention these days. What is PCOS, and why is it so important to understand?
So PCOS is a hormonal disorder, affects something like 1 in 10 women who are of childbearing age. It does involve the ovaries, obviously, from the name, but it's way more than just having cysts on them.
So not just those little fluid sacs we talked about.
Nope. With PCOS, it's a whole messed up interplay of hormones, leads to a bunch of different symptoms.
I'm all ears. Tell me more about these symptoms.
Well, the PDF says to diagnose PCOS, you need at least 2 out of 3 things. Irregular or absent periods, which we talked about as amenorrhea, signs of high levels of androgens, those are like the male hormones, and then actually seeing polycystic ovaries on an ultrasound. But PCOS can do a lot more than just those core things.
Sounds like it can really impact a woman's life on many levels.
Absolutely. You can have hirsutism, which is excess hair growth, acne, trouble losing weight, harder to get pregnant. And then, more seriously, PCOS makes you more likely to get type 2 diabetes, heart disease, even sleep apnea.
Wow, so it's not just a reproductive health issue, it's bigger than that.
Exactly. It hits multiple systems in the body, which is why getting it diagnosed and managed properly is so important.
Speaking of conditions with wide-ranging effects, the PDF also gets into endometriosis and adenomyosis. I always get those two mixed up. What's the difference again?
I gotcha. Both involve endometrial tissue, which is the lining of the uterus, growing where it's not supposed to. The key is location. Endometriosis, it's outside the uterus, often on the ovaries, fallopian tubes, even the bladder or intestines.
Oof, that sounds painful.
It can be, yeah. And the pain often follows a cycle, gets worse around a woman's period. Adenomyosis, on the other hand, is when that tissue grows into the muscle of the uterus itself.
So endometriosis, like the tissue's migrating OUT, while adenomyosis is more like it's burrowing IN.
Good way to think about it. Both can cause painful periods, heavy bleeding, pain during sex, and both can make it harder to get pregnant.
Amazing how something so small can cause such big problems. What's wild is that endometriosis can actually spread further, right? The PDF said it can even reach the lungs, though that's rare.
It's true, it can pop up in weird places, which is why it's tricky to diagnose and treat sometimes.
It sounds like both can be pretty debilitating. I'm curious to learn more about treatment options for those later on.
We'll definitely dig into that. Lots of approaches, from pain management to hormones to surgery, depending on how bad it is and what the woman's hoping to achieve.
Okay, time to tackle a topic that can be a bit awkward. Sexually transmitted infections. The PDF starts with candidiasis, which I know is super common. Is that the same as a yeast infection?
Yep, candidiasis is just the medical term for it. It's caused by too much Candida albicans, which is a fungus that normally lives in the vagina, just in small amounts.
So it's not always from sex.
Right. It can be passed sexually, but often it's from hormonal changes, some medications, or even just tight clothes that make things warm and moist down there.
So those over-the-counter treatments usually work.
Yeah, for most cases. But if you're getting them a LUTI, definitely talk to your doctor. It could be a sign of something else going on, like diabetes.
Good to know. Now, what about the bacterial STIs, which the PDF goes into a lot? What are the important things to know about those?
Well, they highlight chlamydia and gonorrhea as the most common ones. And one tricky thing is they often don't cause symptoms, especially in women.
So you could have one and not even know it.
Yep. That's why regular testing is so important, even if you feel fine. If you don't treat them, it can lead to some bad stuff.
Like what?
For women, both chlamydia and gonorrhea can increase the risk of pelvic inflammatory disease or PID, which is an infection up in the reproductive organs, that can lead to chronic pain, ectopic pregnancies, even infertility.
Yikes, that's scary. Do they affect men differently?
They can. Men usually get pain when peeing, discharge from the penis, maybe pain and swelling in the testicles, sometimes even epididymitis, which is inflammation of that coiled tube on top of each testicle.
Sounds like you don't want to mess around with these STIs. The PDF also mentions trichomoniasis, which I'm not as familiar with. What's the deal with that one?
Trichomoniasis is caused by a parasite, not bacteria, but it's spread through sex, just like chlamydia and gonorrhea. And unlike those two, this one often does cause symptoms, especially in women.
What kind of symptoms?
The PDF mentions a frothy, greenish-yellow discharge from the vagina, often with a bad smell, itching, burning, pain when peeing, too.
Sounds super unpleasant. But is it treatable?
Oh yeah, thankfully, usually just one dose of antibiotics does the trick. But gotta make sure both partners get treated to avoid passing it back and forth.
So regular testing and talking to your partner are super important. The PDF also goes into syphilis, which seems more serious, almost historical.
Syphilis has been around for ages, has this whole fascinating but kind of disturbing history. It's known for its stages. Starts with a painless sore called a chancre, where the infection got in. Then, if you don't treat it, you can get a rash. Then it goes into hiding in your body and eventually can damage organs like your heart, brain, and blood vessels.
So it's like a master disguise changing over time.
Exactly. And that's why it's so risky. It can look like other things and just hang out in your body for years before causing major problems.
Speaking of history, the PDF mentions a weird connection between syphilis and powdered wigs.
Oh yeah, that's a good one. Apparently, back when syphilis was a big problem in Europe, one of the symptoms was hair loss. So those huge powdered wigs became a way to cover up the baldness from syphilis. Talk about a fashion statement with a dark side.
Wow, you learn something new every day. It's crazy how things are connected. Now, before we move on to men's health issues, there's one more STI I want to touch on, HPV. It's super common, but there's still a lot of confusion about it. What are the key things to know?
You're right, HPV is everywhere. Most people will get some form of it at some point. The good news is most HPV infections clear up on their own without causing problems.
So what's the big deal then?
Well, the worry is that some types of HPV, the high-risk ones, can cause certain cancers.
Like cervical cancer.
Exactly. That's why Pap tests are so important for women. They can catch those precancerous changes early so they can be treated before they turn into cancer.
So it's like a screening tool to
Yeah.
find those high-risk types before they cause trouble.
That's it. And the great thing is now we've got a vaccine that can protect against those cancer-causing types of HPV.
That's awesome. I remember when the HPV vaccine came out, it was a big deal.
It was, but the science is clear. It's safe and effective at preventing those cancers.
Okay, now that we've got the STI basics down, let's talk about men's health. The PDF starts with benign prostatic hyperplasia, or BPH, which we mentioned briefly earlier. Can you remind me what that is again?
Sure. BPH is super common as men get older. It basically means the prostate gland, which is that walnut-sized gland below the bladder, gets bigger.
And why does it get bigger?
We don't know exactly, but it's likely tied to those hormone changes that come with age. As men age, the balance of hormones, specifically testosterone and estrogen, shifts. This can lead to more of a hormone called dihydrotestosterone, or DHT, which tells those prostate cells to grow.
So another hormonal domino effect, like we talked about with PCOS.
You got it. And as the prostate gets bigger, it can push on the urethra, which is that tube carrying pee from the bladder. This can cause all sorts of pee problems.
Like?
The PDF lists a bunch. Trouble starting to pee, a weak or stop-and-go flow, feeling like you haven't fully emptied your bladder, having to pee more often, especially at night.
Sounds like it could make for some rough nights.
Yeah.
I remember the PDF also mentioned a connection between BPH and gynecomastia, which is when men develop breast tissue.
Yep. That's another possible side effect of those shifting hormone levels, especially in men with BPH. Usually harmless, but can be tough emotionally for some men.
It's crazy how those hormone changes can have so many ripple effects throughout the body.
Yeah.
Now, the PDF also talks about prostate cancer, which is obviously much more serious than BPH. How's it different?
Well, both involve the prostate, but prostate cancer is a malignant growth. That means it can spread. BPH is benign, so it stays put.
So even though both make the prostate bigger, cancer is the real worry.
Exactly. And sadly, prostate cancer often doesn't have any noticeable symptoms in the early stages. That's why those regular screenings are so important, especially after age 50.
What are those screenings like?
The main ones are the prostate-specific antigen, or PSA, blood test, and the digital rectal exam, or DRE. The PSA test looks for a protein made by the prostate. High levels could mean cancer, but could also be from other things like BPH or even just having ejaculated recently. The DRE involves a doctor feeling the prostate through the rectum.
Okay, I can see why some men might hesitate, but it seems like they could really save lives.
They absolutely can. Early detection is key with prostate cancer. When it's caught early, before it spreads, the chances of survival are much higher.
Now, let's wrap things up with testicular conditions. The PDF lists a few different types of testicular masses, both benign and malignant. Can you break those down for us?
Of course, we talked about the benign ones earlier, the varicoceles, hydroceles, and spermatoceles. Those are usually nothing to worry about and often don't need treatment. But testicular cancer is a whole other ballgame.
What should men be on the lookout for? What are the signs of testicular cancer?
The most common sign is a painless lump or swelling in one of the testicles. You might also feel a heaviness in the scrotum, a dull ache in your lower belly or groin, or even some tenderness or enlargement of your breasts.
So any strange changes down there warrant a trip to the doctor.
Absolutely. Always better to be safe than sorry. Early detection is crucial for treating testicular cancer successfully.
Now, the PDF mentioned that some testicular cancers can actually produce hormones.
That's right. Some tumors pump out hormones like human chorionic gonadotropin or HCG, which is the pregnancy hormone. This can sometimes lead to symptoms like breast enlargement or tenderness in men.
Wow, that's wild. It's like these cancer cells are hijacking the body's normal hormone production.
Exactly. It shows how intricate and connected our bodies are.
This has been a fascinating, if slightly unnerving, overview of reproductive health issues.
It's a lot to absorb, but hopefully it's been helpful. Remember, knowledge is power when it comes to our health.
Yeah, good more.
All right, so ready to dig into some more of these reproductive health details?
Definitely. Especially curious about some of the conditions that specifically affect women. This PDF goes pretty deep on menstrual stuff, and there are a few terms I'd love to get straight.
Happy to help. Medical jargon can be a mouthful, even for us healthcare folks. What you got?
Well, there's menorrhagia, metrorrhagia, and even monometrorrhagia. They all sound kind of similar, but I'm guessing they mean different things.
You got it. They each have their own specific meaning. Menorrhagia is basically super heavy or long periods, like changing your tampon or pad every hour or two, kind of heavy.
Okay, that makes sense.
Metrorrhagia, that's bleeding between periods, those surprise spotting episodes.
Gotcha. So what about that mouthful monometrorrhagia?
That's the combo. Heavy or long periods, A&D bleeding between periods, both at once.
Double whammy. Starting to see why using the right terms matters. The PDF also goes deeper into dysmenorrhea, those painful periods we touched on earlier. Talks about primary and secondary dysmenorrhea. Difference.
Right. Primary dysmenorrhea is basically just really bad cramps, not caused by any specific medical condition. Secondary dysmenorrhea, though, that's pain caused by something else going on, like endometriosis, fibroids, or PID.
So if someone's suddenly having way worse period pain than usual, might be worth getting checked out.
Exactly. Rule out anything else that might be causing it. The PDF also goes into the science behind those cramps. Mentions prostaglandins, remember those from biology class?
Vaguely.
So prostaglandins are like hormones, but they cause inflammation and pain. During your period, they make the uterus contract to help shed the lining. But those contractions are what cause the cramps.
Ah, so that's what those heating pads are actually targeting.
Yep. Heat helps relax the muscles and lower those prostaglandins, which eases the cramping.
Suddenly loving my heating pad a whole lot more.
Yeah.
Back to the PDF. It talks more about amenorrhea, too. Breaks it down into primary and secondary.
Right. Primary amenorrhea is when a girl hasn't started her period by 15. Could be from a bunch of things like genes, hormone problems, or even anatomical issues.
And secondary is when someone who was having periods regularly stops for 3 cycles or more.
You got it. We talked about pregnancy being the most common reason, but could also be big weight loss, too much exercise, stress, even some medications. Seems like our bodies are always sending signals about what's going on inside.
Speaking of signals, the PDF mentions dysfunctional uterine bleeding, or DUB. What's that all about?
DUB is kind of a catch-all term for abnormal bleeding from the uterus. But it's when there's no clear cause, like fibroids, polyps, or a hormone problem.
So is what they call it when they can't figure out why you're bleeding.
Pretty much, yeah. It's basically irregular bleeding with no explanation.
Sounds frustrating. Hard to deal with your period when you don't know what to expect.
Definitely. And it's worth getting checked out because even though DUB itself might not be serious, sometimes it points to a hormone issue that needs fixing.
Okay, let's go back to those benign ovarian cysts for a sec. The PDF gets into how they actually form.
Right. So remember how each month a follicle grows on the ovary as part of the menstrual cycle? That follicle holds an egg and is full of fluid. Ovulation happens when it bursts and releases the egg. But sometimes it doesn't burst or it doesn't fully disappear after releasing the egg. That's when a cyst can form.
So they're like leftover bits from ovulation?
You could say that. Most of the time they're harmless and go away on their own. But we talked about how they can cause pain, pressure, or even rupture, which needs a doctor's attention.
Right, right. Let's talk more about polycystic ovary syndrome, or PCOS, which we touched on earlier. The PDF makes it clear that it's not as simple as just having cysts on your ovaries. There are specific criteria for diagnosing it.
Absolutely. It takes at least 2 out of 3 specific things to be diagnosed with PCOS.
Let's hear them. What are the big three?
First, there's oligomenorrhea, or amenorrhea, meaning those irregular or missing periods. Then there's hyperandrogenism, which is having too much of the androgens, those male hormones. And finally, yeah, seeing polycystic ovaries on an ultrasound. That's where the name comes from. But it's tricky because not every woman with PCOS will have visible cysts.
So it's not just about the cysts, but the whole picture of hormones and menstrual cycles.
Exactly. And we talked about how those wonky hormones can have a domino effect, from acne and extra hair to insulin resistance and higher risks of things like diabetes and heart disease down the line.
Another reminder that hormones are a big deal for our overall health. Now, the PDF goes into uterine fibroids too. I'll be honest, I'm not really sure what those are.
I can explain. Uterine fibroids, also called leiomyomas, are basically benign tumors that grow in the muscle wall of the uterus. Imagine them like little knots of muscle tissue that aren't cancerous.
Okay, so not cancerous, but can they still cause problems?
They can. The PDF says they're actually super common. Up to 80% of women will have them at some point. And most of the time, they don't cause any symptoms. But sometimes they can grow big and press on other organs or cause other issues.
Like what?
Well, some women get heavy periods, pain, or pressure in their pelvis, back pain, constipation, or pee a lot. Really depends on how big the fibroids are and where they're located.
That's a lot of potential problems, so how are they treated?
It really depends on the woman and how bad her symptoms are. If they're small and not causing trouble, sometimes the best approach is just to watch and wait, see if they change. But if they are causing problems, there are medications that can help, and there are surgeries to remove them.
Sounds like a lot of options to discuss with your doctor.
Definitely. It's a personal decision, and it's important to work with your doctor to figure out the best plan for you.
Now let's circle back to endometriosis and adenomyosis. Those conditions where endometrial tissue grows where it shouldn't. How are they diagnosed, and what are the treatment options?
Diagnosing them can be tricky because the symptoms can look like other conditions. The PDF says doctors might do a pelvic exam, an ultrasound, or even a laparoscopy, which is a surgery where they put a tiny camera in to look at the pelvic organs directly.
So it's not always a clear-cut diagnosis?
Nope, sometimes it takes a bit of detective work to rule out other things and figure out what's really going on. Treatment-wise, there are lots of options, and the best one depends on how bad the condition is and what the woman wants to achieve. Pain management is often a big part of it, and that can involve over-the-counter painkillers, prescription meds, or even alternative therapies like acupuncture. There are also hormone therapies like birth control pills or GnRH agonists, which can stop the endometrial tissue from growing and help with the pain.
So ways to manage the symptoms? But is there a cure for either of these conditions?
Unfortunately, no cure. But surgery can sometimes be an option to remove the endometrial growths, or in really severe cases, a hysterectomy, which is removing the uterus. Surgery is usually a last resort, though, and it's important to weigh the pros and cons carefully.
It sounds like there's a lot to think about when making treatment decisions for those conditions.
For sure, it's a really personal process, and talking openly with your doctor is essential to figure out what's best for your individual needs and goals.
Okay, let's switch gears back to STIs. We talked about yeast infections, which are fungal, but now let's get back to those bacterial STIs. The PDF focuses on chlamydia and gonorrhea as the main culprits. What makes them so worrisome?
As we mentioned before, one of the trickiest things about chlamydia and gonorrhea is that they can be completely silent. That means people can have them without any symptoms, especially women.
So someone could be passing it on without even knowing they have it.
Exactly. That's why it's so important to get tested regularly, especially if you're sexually active. If those infections aren't treated, they can lead to some pretty nasty complications, especially for women.
Like what? Fill us in.
Well, in women, both chlamydia and gonorrhea can up the risk of pelvic inflammatory disease, or PID. That's when the infection spreads to the upper reproductive organs. PID can cause chronic pelvic pain, ectopic pregnancies, and even infertility.
Definitely sounds like something you don't want to mess with.
Mhm.
How about men? Does it affect them differently?
It can. For men, these infections can cause pain when they pee, discharge in the penis, and sometimes even pain and swelling in the testicles. Sometimes it can lead to epididymitis, which is an inflammation of that coiled tube on top of the testicle.
Okay, so definitely not something to ignore. The PDF also mentions trichomoniasis, which is caused by a parasite, right? What are the signs of that one?
Trichomoniasis is often more noticeable than chlamydia or gonorrhea, especially for women. Usually it's a frothy, greenish yellow discharge from the vagina, often with a funky smell. Itching, burning, pain when peeing are common too.
Sounds pretty awful. Good thing it's treatable with antibiotics.
Yep. A single dose usually does the trick, but it's important that both partners get treated, otherwise they can just pass it back and forth.
Makes sense. Got to stop the ping pong effect. Now, the PDF also goes into syphilis, which seems a lot more serious. Why is that?
Syphilis is a bacterial infection, been around forever. It's known for its stages. First, there's this painless sore called a chancre, where the infection got in. If you don't treat it, you might get a rash. Then it goes into hiding in your body, and eventually it can start damaging organs like the heart, brain, and blood vessels.
Wow, it's like a sneaky ninja, changing and hiding over time.
Exactly. That's what makes it so dangerous. It can mimic other things, and then suddenly, bam, you've got serious problems.
Speaking of hiding, the PDF had this creepy historical fact about syphilis. Apparently, hair loss was a common symptom.
Oh, yeah. And you know those huge powdered wigs that were all the rage back then? People used them to cover up the baldness caused by syphilis? Fashion with a dark side?
Never knew that. Makes you look at powdered wigs differently.
Oh,
Okay, on to another viral STI, human papillomavirus or HPV.
mhm.
Super common, but you mentioned there's a vaccine now. Tell us more about HPV and why the vaccine is so important.
Right. HPV is actually a whole bunch of viruses, over 200 of them. Some cause warts on your skin, while others infect the genital area, causing genital warts. The big worry is that some types, the high-risk ones, can cause cancer.
Cervical cancer, right.
Exactly. HPV is the main cause of cervical cancer, but it can also cause other cancers like anal, vulvar, and even some head and neck cancers.
So the HPV vaccine is basically a cancer preventer.
You could say that. It protects against those most common high-risk types, so it really lowers the chances of getting those cancers. It's recommended for both boys and girls, usually starting around age 11 or 12, and it works best before someone becomes sexually active.
It's amazing that we have a vaccine that can actually stop cancer from developing.
It's a huge step forward for public health, for sure.
Okay, let's get back to men's health. We talked about benign prostatic hyperplasia, or BPH. Can you refresh my memory on what causes that?
So BPH is mostly caused by changes in hormones as men age. Specifically, the balance between testosterone and estrogen shifts, which can lead to higher levels of a hormone called dihydrotestosterone, or DHT. DHT makes the prostate cells grow, which is what causes the prostate to get bigger.
Ah, another hormonal domino effect, just like PCOS in women.
Exactly. Hormones are involved in so many bodily functions, and as we age, those shifts can have unexpected consequences.
The PDF mentioned that BPH can sometimes lead to gynecomastia, which is when men develop breast tissue. What causes that, and is it something to worry about?
Gynecomastia is basically an imbalance of hormones, usually too much estrogen compared to testosterone. It can happen at different points in life. In newborns, it's often from exposure to mom's hormones before birth. In teenagers, it's often just a temporary thing during puberty and usually goes away on its own. And in older men, it can be caused by various things like aging, certain meds, obesity, or liver problems.
So sometimes it's normal, but sometimes it could signal a bigger problem.
Right. If you notice any changes in your chest area, best to get it checked out by your doctor, just to be safe.
Okay, good advice. The PDF also gets into prostate cancer, which is a much bigger deal than BPH. What are the key things to know about that?
Prostate cancer is the most common cancer in men, other than skin cancer. And like a lot of cancers, it often doesn't cause any noticeable symptoms early on. That's why those regular screenings are so important, especially for men over 50.
Remind us about those screenings again.
Sure. The two main tests are the prostate-specific antigen, or PSA, blood test, and the digital rectal exam, or DRE. The PSA test measures a protein made by the prostate. High levels could mean cancer, but could also be from other things, like BPH or even just ejaculating recently. The DRE involves a doctor feeling the prostate through the rectum.
I can see why those might make some men a bit uncomfortable, but it seems like they could be life-saving.
They absolutely can. Early detection is key for treating prostate cancer successfully. If it's caught early before it spreads, the chances of survival are much better.
Okay, let's move on to testicular conditions. The PDF mentions a few different types of testicular masses, some benign and some not. Can you break those down for us?
Sure. We talked about the benign ones earlier, varicocele, hydrocele, and spermatocele. Those are usually harmless and often don't need treatment, but testicular cancer is a different story.
What are the red flags for testicular cancer? What should men watch out for?
The most common symptom is a painless lump or swelling in one of the testicles. You might also feel a heaviness in the scrotum, a dull ache in your lower belly or groin, or even some tenderness or enlargement in your breasts.
So any weird changes down there, get them checked out.
Absolutely, don't take any chances. Catching it early is key for successful treatment.
The PDF also mentioned that some testicular cancers can actually produce hormones.
Yep. Some tumors make hormones like human chorionic gonadotropin, or HCG, which is the hormone that's produced during pregnancy. This can sometimes cause symptoms like breast enlargement or tenderness in men.
Wow, that's incredible. It's like the cancer cells are messing with the body's natural hormone factory.
Exactly. Just goes to show how complex and interconnected our bodies are.
Okay, we're almost done with this section, but there are a few more conditions to cover. The PDF describes some that can affect the penis and foreskin. What can you tell us about those?
Sure. There's phimosis and paraphimosis, which affect the foreskin. Phimosis is when the foreskin is too tight and can't be pulled back over the head of the penis. Paraphimosis is when the foreskin gets stuck in that pulled back position and basically chokes off the head of the penis, which can cut off blood flow.
Ouch, those both sound painful.
They are, and they need to be treated quickly by a doctor. The PDF also mentions hypospadias and epispadias, which are conditions where the opening of the urethra where the pee comes out isn't in the right place.
So instead of being at the tip of the penis, it's somewhere else.
Yep. In hypospadias, the opening is on the underside of the penis, and in epispadias, it's on the top side.
I'm guessing surgery is usually needed for those.
Usually, yes. They typically do the surgery early on to make sure everything worked properly for peeing and later on for sexual function.
Okay, and then there's priapism, which sounds a bit mysterious.
Priapism is basically an erection that won't go away, and it's often painful. It lasts for more than 4 hours. It can be caused by a bunch of things, like medications, blood disorders, spinal cord injuries, and even recreational drugs.
So not always a good thing then.
Nope, not at all. Priapism is often a medical emergency that needs to be treated quickly to avoid damage to the penis.
Okay, good to know. What about Peyronie's disease? That's mentioned in the PDF too.
Peyronie's disease is when scar tissue forms inside the penis, making it curve or bend during an erection. It can make sex painful or difficult. We don't know exactly what causes it, but it might be from repeated small injuries to the penis.
Well, this has been a fascinating and sometimes a little TMI journey through reproductive health conditions.
It's a lot to take in, for sure, but the main message is knowledge is power when it comes to your health. The more you understand these conditions, the better you can take care of yourself and get help when you need it.
Totally agree. And it's important to remember those regular checkups and screenings. Early detection can make a huge difference for a lot of these conditions.
Absolutely.
Back again for the final part of our deep dive into reproductive pathologies. We've covered a ton of ground, from wonky periods to STIs and conditions affecting both men and women.
It's been quite the journey. As we wrap up, I think it's worth highlighting those incredible advances in how we diagnose and treat these conditions. It's pretty amazing what we can do now.
Totally. That PDF you shared talked about some really cool new technologies that are making a huge difference in reproductive health, like those imaging techniques, ultrasound, and MRI. Those really caught my eye.
Oh, yeah. Those have been game changers for seeing what's going on with the reproductive organs. Ultrasound that uses sound waves to make pictures, right? It's become the go-to for looking at everything from ovarian cysts to fibroids, even checking on babies during pregnancy.
And the detail in those ultrasound images is incredible.
It is. Then there's MRI, which uses magnets and radio waves. Those can give even more detailed pictures, especially of soft tissues. It's a huge help for diagnosing things like endometriosis, where those tiny bits of endometrial tissue can be all over the place in the pelvis.
So it's like giving doctors X-ray vision for the reproductive system.
Pretty much. And the technology keeps getting better. The PDF talked about transvaginal ultrasound, where they put a small probe inside the vagina.
Makes sense. Get a clearer picture that way.
Exactly. Gets closer to the organs. And with MRI, There's functional MRI now. It can actually track blood flow and activity in the tissues. That helps doctors tell the difference between benign and malignant growths, for example.
Wow, that's pretty sci-fi. Seeing the body in action like that. The PDF also talked about minimally invasive surgery, which seems to be changing the way a lot of these conditions are treated.
Minimally invasive surgery is a big deal. Instead of making big incisions, they use these special tools and a camera to do the surgery through tiny cuts.
The PDF mentioned laparoscopy.
Yeah, laparoscopy is a common one. They put a tiny camera through a small cut in the belly so the surgeon can see the pelvic organs. Then they use these tiny instruments, put in through other small cuts, to do the surgery, like removing fibroids, treating endometriosis, even doing a hysterectomy.
So it's like operating through a keyhole.
Exactly. And it's way better for patients. Less pain, faster recovery, and fewer complications compared to traditional open surgery.
That's amazing. No wonder it's becoming so popular. They even mentioned robotic-assisted surgery, which sounds even more high-tech.
Oh, yeah. Robotic surgery takes things to a whole new level. It's still minimally invasive, but the surgeon uses a robotic system to control the instruments. It's like having tiny, super precise hands working inside the body.
So the surgeon's like a pilot, controlling the robot from a console.
Exactly.
Wow.
And the robot's arms can move in ways that human hands can't, so it's even better for delicate procedures.
It's mind-blowing how much surgery has changed thanks to technology.
It really is. And it's not just surgery. There are big advances in medications, too. The PDF talked about hormone therapies, which are used a lot for PCOS and endometriosis.
Right, I remember that.
Those can help balance hormones, reduce pain, even shrink those endometrial growths.
Great to have those options, especially for those really tough conditions. And I know they're always working on new and better treatments.
Absolutely. One area where there's a lot of research is targeted therapy, especially for reproductive cancers. Those therapies are designed to attack just the cancer cells, leaving the healthy cells alone, which means fewer side effects.
So like a smart bomb, zeroing in on the bad guys.
Exactly. It's all about personalized medicine, tailoring the treatment to that specific cancer.
It's amazing stuff. But the PDF also stressed the importance of simple lifestyle changes too, right?
Oh yeah, that's always important. Things like keeping a healthy weight, eating well, getting some exercise, and managing stress, those can have a huge impact on reproductive health.
Good reminder that we have more power over our health than we think sometimes.
Definitely. Healthy habits can go a long way in preventing or managing a lot of these conditions.
Well, we've covered a lot in this deep dive. It's been fascinating to explore this whole reproductive system, all its intricacies, and the challenges these pathologies can bring.
It has been a wild ride. The bottom line is, knowledge is power. The more we understand these conditions, the better equipped we are to take care of ourselves, make good decisions, and speak up for our own health.
Couldn't agree more. And we can't forget about those regular checkups and screenings. Talking to your doctor, being proactive about your health, that's so important.
Yep, prevention is key.
Well said. As we wrap up this deep dive, I want to leave you with one last thought. We've talked about a lot of complex and challenging stuff today, but let's not forget how amazing our bodies are.
Love that. Our bodies are capable of incredible things, from creating life to healing themselves.
Exactly. Even when we face health challenges, by learning, seeking support, and taking care of ourselves, we can overcome those challenges and live our best lives.
Absolutely. Couldn't have said it better myself.
Thanks for joining us on this deep dive into reproductive pathologies. Until next time, keep learning, keep asking questions, and stay healthy.